All right, not seeing any other people in the waiting room, and it is 12 o'clock. So I'd like to welcome the 25 of you to today's Lunch and Learn. I'm Jeremy Whitaker. I'm supposed to say what I do, I guess, of many things at IPHA, and but this time I was a member of the education committee up until I had a class conflict. But anyway, we have a great season plan. There's only one after this one, I believe, maybe two. So hopefully you are signed up for the series. If not, you sure have gotten an email about that. So please make sure you sign up. And again, this session is being recorded and will be posted to the IPHA YouTube channel. So again, please keep your microphones muted throughout the presentation and cameras off. Again, that helps with bandwidth. However, if you do ask a question, feel free to unmute and show yourself. Not required. And so again, you can put questions in the chat. As moderator, I will pull them out and save them for the end. You can direct them straight to me if you want to be anonymous, or you can just type them with your own name on it for everybody to see. And then with that, I will go ahead and introduce our speakers for today. We have Jenna Heiar and Alyse DeVries from Sierra Gorda Public Health. They'll be here talking about childcare today. And as a parent myself, years 0 to 5 for a working adult are impossible. And so I'm excited to hear about anything that can help people either afford childcare, get access to childcare, let alone the mysterious wraparound care. All of it, we need more of it and more access and for more people. So very excited about today's presentation. With that, I'll hand it off to them.
All right, welcome everybody. My name is Alyse DeVries. I'm the Director of Workforce Innovation Strategy and Outreach at North Iowa Area Community College, so NIAC up in North Iowa. And previously of CG Public Health, I still work very closely with public health projects with Jenna and the rest of the team there. And then I get to co-present with Jenna. So we're going to talk specifically about our IMPACT project, which IMPACT stands for Innovative Multi-Sector Partnerships for Community Transformation in Public Health. And this was the funding opportunity that we had through the de Beaumont Foundation that supported our child care wage supplement program that we'll be talking about today. Jenna, can you do the next slide there? So we have a large group of partners that we've been working with for this project. We have the Mesa City Chamber of Commerce, our Child Care Resource and Referral Team, Iowa Women's Foundation, CG Public Health, NIAC, the school district here in Mason City. We have Charlie Brown Preschool and Child Care, our local YMCA, and then the de Beaumont Foundation, Reach Solutions, and Johns Hopkins University, which are all part of the IMPACT grant team that we've been working with.
Yeah, so we're going to talk about a few things today, starting with obviously the community problem that we identified as a priority, which is access to childcare. Talk a little bit about the data that we had at the start of this project and the data that we've collected, along with the partnerships that we've had and maintained, sustained, and also new ones that have come along the way that have been really wonderful. So, and then I'll touch a little bit at the end about sustainability too, and Alyse is going to talk a lot about a workforce ready program too. So that's a little bit of what we're going to cover today in terms of this IMPACT project.
All right, so for the first part of this timeline, first we get asked a lot, why public health? Why is childcare a public health issue, which most of you, I'm sure, can totally talk about, but really it's about public health being that convener for issues that are community-wide. And that's kind of where we started when we originally wrote this grant, is for the de Beaumont Foundation, for the IMPACT grant, really it was looking for a project to create significant impact in the community through a private-public partnership. And we thought it was a really great opportunity as a public health department to work with this team to be able to utilize these funds. And so we were really looking at, what's impacting both public and private sectors in our community. And every strategic plan, including public health, included access to quality childcare as far as all strategic plans. Every private business, the chamber, everyone had childcare on their strategic plans. It came up on the agenda for many community meetings, bringing any businesses to the area, even being able to like recruit doctors to our area. A lot of it came down to we just really didn't have access to childcare. So that was the topic that we wanted to work on for our DeBeaumont Foundation application. And of course, right in the beginning with a grant, you have to solve the problem. So we were like, okay, we need access to safe quality childcare in our area. So we're going to build a new childcare center. And that was the idea at the beginning of this whole project. We're going to build a new building. It was going to be at the college where I currently work at the community college. We're going to be able to wrap in work-based learning. We'd have student workers being able to support it. And that would mean additional access to childcare. And so I think we'll probably touch quite a few times during this presentation on one of the biggest parts of our success is that this funding was flexible. So in our application, we just really had to talk about the problem that we have in our community. We did not have to submit a strict budget, scope of work, anything that really tied us down to exactly what we were going to be doing with $100,000 to be able to create impact in our area. So we have that crossed out on purpose on the slide. We started with, we're going to build a new childcare center, and we'll talk a little bit more about our journey to really define what our problem was and be able to best use this funding.
So going from there to put it kind of in a different context from our CHA chip, we use data specifically from our 2022 Community Health Assessment Survey to support the DeBeaumont Foundation. And this is just a snapshot of some of that data of the cost burden that we are well aware of that fell into our 2020 to 2023 Community Health Improvement Plan. So starting here, first we identified this as a community-wide problem. We had a shared work group on early childhood issues. And as you all know, this all came from the data that we had, showing that childcare is the third lowest paid profession. And so I put some of this data out here because I think everyone on here probably knows how significant of a crisis this is, that we have long wait lists and everything else. But I'm going to show you as we go through it, we really had to frame this data in a way that was relevant to all of our different audiences that we are working with. And we knew that the data would continue to really drive this story. And so we really framed it from a workforce perspective, knowing and sharing with people why this is a workforce issue. Although we know that many of our businesses already recognize this as a workforce issue during the pandemic. And especially after the pandemic, because a lot of people did leave the workforce because of it. So what we initially thought was we have, like Alyse said, we have all these slots and we can't fill them. And it was really the data that led us to seeing it's not about geographic location and a space for children. It's really comes down to the workforce and not being able to hire people at such a low wage when the McDonald's and Quick Trips are hiring people at a higher wage just to start. So this is a little bit of how we frame this data to really get across to our community. I'll also say that we had different partners at the table that really helped us convey this information. So a large one being Child Care Resource and Referral. And I think Kathy is actually on this. So Kathy, at any point, if you want to jump in, feel free. She was able to provide us with very up-to-date, accurate county level data that again showed our shortfall of spaces and really helped us hone in on what should be the priority of this wage supplement program that we are going to get to. And then the chamber, the Mason City Chamber of Commerce, was also really foundational to this because they had the relationship with the business community. So this information coming from the chamber, it was received differently than it would have been likely received from public health or any other partner for that matter. So, there, Kathy, now we see your face twice. A picture and on screen. So another part of this project that was one of kind of our areas of success was everyone that's been involved in this project from the beginning, this collaborative, has had a shared goal and mission, and we've all had a lot of passion in the room for this topic. Like Jeremy mentioned at the beginning, a lot of us could relate to that issue when you have 0 to 5-year-olds. And so we started with a mission to ensure that every child has access to reliable, affordable, quality childcare. And so we did integrate the quality piece in this, and it was really essential that we had Kathy as a previous childcare director and kind of our childcare expert. And then we also had a current childcare director at the time on our group as well. And so that insight was really invaluable because we changed and thought about a lot of things due to their real life experience specific to our location. So again, something we identified as like, this is one of the reasons we were able to launch this program is having the right people at the table. We realized pretty early on that it wasn't necessarily having everybody at the table to help with this, even though we know many people are interested in it, but it was really having the right people at the table. I'm going to go to the next slide here. So once we got the grant, we went through a few different processes, one of them being our health equity impact assessment. And this is like a health impact assessment that really made us take a step back from where we were at initially and just look at what we're doing and why, and if the data is leading us there. And then the group also got to go to Washington, D.C. as part of the DeVries Foundation and do a results-based accountability process. So this, I was not actually involved in this, but 4 people from our collaborative were, and it's really like almost like a glorified QI project where you really get down to the solutions and the why and the root causes. Kathy, do you want to add anything else about that results-based accountability? No? Okay. And then something else that we relied heavily on was talking to other people in the state. And I have another slide on this coming up, but really learning from others what they have done, what has worked well from them, not reinventing the wheel, but comparing because everyone is doing something a little bit different. And then, so our first big pivot, like Alyse mentioned, was changing the whole program, thinking we're going to build a childcare center and solve all of our problems, to realizing it's not space that we need, it's workers. And that was just, again, based on our local data. And what we decided to do was have listening sessions. And these listening sessions, I'm sorry, I'm going back one more. These are a few examples of all the different things just in our state that were initiatives that people were working on. So as you can see, there's quite a variety when it comes to purchasing slots, backup childcare options, stipends, flexible schedules, etc. And the one that we decided would be most beneficial was the wage supplement program, similar to Hamilton and Johnson County. So back to our pivoting, our data collection, we did an incentive-based listening session. And so we got together daycare center directors from all of our daycare centers, thanks to Kathy, because again, she had that direct relationship with them. So she was able to call every single one of them and just let them know, hey, we're having this meeting. We want you to come. We value your input. And that really helped us. So we had 2 sessions, one for center care directors and then one for in-home providers too. And something that was really important is we changed our direction slightly based on these listening sessions. We had initially assumed that all of our providers in our county needed the same thing, and that was more wages for their staff. Well, with in-home providers, we listened to them and we learned about some of their challenges, and some of their challenges were different. They were in regards to home repairs and other things, not necessarily wages. And so this again allowed us to really hone in on what is our program going to focus on, and what does our community need to lift us out of this crisis and essentially stop the bleed. We've kind of said that a few times, like we need to at least stop the bleeding that's going on, because we can't continue to lose more childcare and have it be more scarce in our community. So fast forward here, and there's a lot more that's went into this in between. But we ended up at deciding to put a $2 an hour increase to staff that work at child care centers making $20 or less. And this was our way of making sure that we can offer staff more, but not put that cost back on families. So, because as that first slide showed with our data from our community health assessment, we knew we didn't want to increase the data, or we didn't want to continue to worsen the affordability for parents, because that would just cause more parents to leave the workforce. And so again, it's not that we thought this would raise our average wage to providers to almost $14 an hour, which still doesn't sound like all that much, but it's a 17% increase, and that would be huge. And so we looked at what would we need to do this, and we realized for all of our centers and center staff, we would need $1.2 million to do this. And so then we started talking about the community investment and leaning not only on the government, but also the businesses, schools, grants, and things like that. So that's really how Child Care Works was developed. And I don't know if it was fate or what, but we knew we wanted to have an employer engagement breakfast. And again, the Chamber of Commerce was really our champion when it came to the business community. And this was something that we knew we wanted to have, but then an opportunity came out from the state, partly through us and other organizations working through the Iowa Women's Foundation, who worked very closely with the state. And they had money that they were able to put towards childcare solutions, whatever that looks like in certain localities. And so we had a very quick deadline, and so we very quickly worked as a team to host an engagement breakfast and really talk to our business community about why they should invest in this program and how it's going to help them in the long run. And so that's where some of those slides that I showed earlier with the data, we really use that to tell our story. Kelly and Colleen specifically on our team were the ones that did that. And we had pledge sheets. We had testimonials, again, from our listening session with our childcare providers. And we asked them to pledge for 3 years to kind of add to the sustainability of this project. One of the concerns from the start has been sustainability. And so I'll talk a little bit more about that as we go on as well. So again, like I mentioned, our goal was to raise $1.2 million. We knew if all of our centers enrolled right away, we would need a lot of money. And so we used some of the money from this grant initially. So the De Beaumont Foundation, we were able to put that money directly into this. And then we also raised over $300,000 from the business community in our area. And it was at that point that the state told us they were going to match us 2-to-1. And so that was pretty incredible. And they were doing this for no more than 12 counties in our communities in Iowa that had applied for this opportunity. So to date, we have raised with that, we are almost at $1 million. We have hired a child care works administrator part-time to help facilitate this program. And Alyse is going to talk a little bit more about where we're at right now with it. So it kicked off in January of 2024. And again, sustainability has been huge from the start. One of the concerns we heard from child care center directors was, is this sustainable? And I think at the time we said, no, it's not, but we have to start somewhere, and we want to make this become sustainable if we can implement it and show that show through the data that this is working. And so, like I said, we did ask businesses to pledge for 3 years if they were able. And we've also done a lot of work with the state. We've had legislators here at our offices at CG Public Health talking to them about this. We had Ashley Hinson. We set up a meeting with her and met with her at the chamber. And this middle photo on the last slide is Kathy and Kelly and Bridget, and one of our board of supervisors who is down at the Capitol advocating for more funding related to this, and funding that is the type of funding we need. And then we're also doing a strategic planning session in May to try to figure out exactly our next steps and talk more about sustainability. And we also have a grant application in the works as well. So that's kind of where we're at with the Child Care Works program. Through the De Beaumont Foundation, we were also able to get connected with a private consulting firm, and they were able to do a calculation that really allowed us to look at the inputs of our program and what basically the ROI was on it. And so we were able to estimate based on like our $2 an hour wage increase and the Child Care Ready program that Alyse is going to dive more into, and also the state child care subsidy that's going on right now, and all the impacts that has on not only the state, but children, parents, and the economy. And so these numbers weren't just thrown out there. They were very carefully looked at based on a lot of different data, but we were able to see, we now have this graphic to kind of show the value of programming like this, and we can highlight it depending on who we're talking to. So if we're talking to businesses, we're going to focus on the economy and the impact that we see on the economic output and revenue and things like that. And versus if we're talking to parents of children, we're going to talk more about those learning outcomes and lifetime earnings and things like that. So this was neat because, again, the grant allowed us this opportunity, and it's been really great to be able to use this from advocacy with an advocacy purpose, and give this to people to show them the value of investing in childcare and how important that is.
All right, I'll talk about our Child Care Ready certificate that we've created. So a subset of our team broke off and really worked on workforce development. So our program really supports current workforce, but we did recognize that we needed to recruit into the child care workforce as well. And knowing that our enrollment was very low at the community college as far as early childhood program, we wanted to really put something together. So some type of pipeline now that we have the wage supplement program up and running. So myself with community college, one person on our team from our Mason City School District, and Child Care Resource and Referral, Kathy, got together and worked on creating a Child Care Ready certificate. So this is a non-credit workforce certificate that we've piloted. We're currently in the middle of running it right now with Mason City High School. And this is really focused on workforce skills. So it's through our NIAC Workforce Academy, getting people everything that they need to get started in the workforce. So we did this for childcare. We broke it into 3 full day sessions with our high schoolers, and then also online. So we have our first session was in January. We did an orientation to the childcare occupation, and then we also took a school bus all over town and toured child care centers and really had a thorough tour about all the different rooms, what it's like to work in child care, the kind of the expansion of development of ages as the child care center progressed. So that was really great for the students to see. On day 2 in March, we had one of our faculty members do a class on child and brain development, which was very engaging. And then we also thought it was important to bring in those soft skills. So we also had an afternoon of workplace excellence, which is focused on professional communication and dependability. And it was all focused back towards the childcare workforce. How to be a good employee was really important to have built into this program. And then our third day is next week. We'll be doing infant CPR and first aid. We also have the sheriff's department coming to do their fingerprints, and we have an interviewing and hiring fair. So kind of an employer, like an employer day where the centers can come talk about their center, what their workforce is like, and be able to do some mini interviews and answer questions about working in the workforce. And we really positioned the timing so that these high schoolers could get summer jobs in childcare. So they are completely ready to start their childcare journey as soon as school is out. This was also accompanied by 16 virtual hours. And this, I think, is just really special because once someone starts in a childcare center, they have to go through a lot of training to be able to work. So they have to go through the OSHA Universal Precautions, the Essential Childcare Pre-Service Series, and mandatory reporting. And we already have that built in. So those ones are self-paced online. They have to get done before the end of the program, as well as having their fingerprints already done. They're learning how to fill out their background forms, background check forms. So these students not only will be knowledgeable about working in childcare, they will have tours of childcare centers so they know, kind of what it's like. They'll have those professionalism skills, the safety, the CPR and first aid skills, but also that burden of that extra training that will have to get done after employment will already be taken care of. So they're really going to be ready to go. We have, I believe, 16 students going through it right now, and it's really been great. So we are planning on, now that this pilot program's already almost done, getting back to really figure out, any tweaks that need to be made, and then hoping to be able to offer this in other high schools and also as like an open enrollment community offering as well for people who are looking at getting into childcare workforce. So this has been a really great program to work on. And then Jenna, do you want to go to the next slide? All right, and this is a little bit of us being able to be excited about what success we've had so far. So in Cerro Gordo County, we have 8 child care centers. 7 of them are currently in our wage supplement program. And the last one is in the process. So we have built in some eligibility criteria of having to be in the state IQ4K program, And so they're actively working through getting all of that paperwork done so they can be eligible for the program. So we're almost at 100% enrollment as far as childcare centers in our area. And while we originally had calculated about 1.2 million, we had in-home providers in that. We kind of continued to calculate as we went. So being where we're at, we feel really good about being able to support our workforce this year and in the next couple of years to come. So what we are excited to say is that we launched January 1st, and we've had 97 children added to our center rosters. We've had 33 overall increase in employees, so 33 new childcare employees in Cerro County. We have 44 less children on wait lists, and we have increased by 121 slots in our county. So just by having the workforce there is able to increase our slots that we have available. That was kind of our big aha moment in the beginning, was we have kids, we need more childcare, we need a new building. Well, we found out that we had all the space, we had all the slots, we just couldn't put children into them because we didn't have the workforce to maintain those ratios. So by hiring more workforce, these childcare centers are being able to accept more kids. So those are our very preliminary data that we're able to talk about. So we're very excited. We've also reflected a lot about why this has been successful for us, and a lot of it comes down to the team that we've built. Really having a full circle of stakeholders. So we have providers, we have the chamber really representing the private businesses, we have education, we have the school system, we have YMCA, we have a lot of people at the table, which has been great. We've had the time and the flexibility with the funding to really dive into a very specific needs assessment around this issue in our community, which allowed us to learn a lot and pivot using this funding. And I can't say enough how flexible funding is such a success. But also, just having a safe psychological space to have this team. we've had great engagement, we have great attendance. We have decided that meeting in person is crucial. So in the beginning, it was Zoom, and I don't think the value was quite there to join every time. We have lunch every time we get together. We assign tasks. We identify the strengths that each team member has. And it's really come together to be one of the most impactful teams I've ever been on. So our grant year is about done. But we are choosing to go into a very purposeful strategic planning session coming up, and continuing this for as long as we can with as many different layers of this project as we can. So is that our last slide, Jenna?
I believe so.
Okay.
And this graphic might look familiar to you if you were at the public health conference. Kelly Gertis created it, and she had it on a poster there at a conference. So Kelly, I don't know if you're on the call, but if you want to jump in at all and talk about anything else that we might have missed.
A little bit more about our partnership within our team is we work with the chamber, and the chamber did decide that they could be like the funding owner of this. So our chamber foundation is the actual administrator of the funds. And then we also partnered with Youth Task Force. So we've contracted them for a part-time employee to be the administrator for this program. So we were able to really expand and being able to house it with the partners that make the most sense. So that's been a really great opportunity and connections and partnerships too.
Yeah, and I think at our March meeting, we had distributed a total of $64,000 to date. Again, it was a little bit slower at the start than we expected. Just, getting everything enrolled and all the forms and tracking in place, but that was exciting too. So.
All right, thank you. I think this is where I jump back in. This is your last slide. So I do have some questions that have been submitted. And I will kind of jump around here. One of the ones that just came in Have we seen similar efforts in other counties? And along with that, what barriers do you think there would be to implementing it in a different county?
Good question. I think there are a lot of barriers, and it probably depends on the county. I mean, in Mason City, we are kind of a hub for services, businesses. We have a lot of small rural residents in smaller rural counties around us that travel to us and also have daycare in our region. So I think there's a lot of barriers when it comes to doing this only in a rural county. But we have talked about expanding it someday down the road. That is a hope of ours. But I say it's a barrier for rural counties because they may not have the businesses within those counties to support it, or the administrative help to kind of lift it off the ground.
As far as other counties, we have Johnson and Hamilton counties also have a wage supplement program model that they are working with, and they've been doing it longer than we have. Hamilton County, I believe, has 4 centers and have had a lot of success and are opening their 5th center now because I believe their centers are fully staffed. If someone's on here with the correct data, please chime in. But that's, I think, what I remember from their last report out. And I don't have a current update on Johnson County. Each county model's been a little bit different. Some are doing stipends. So like monthly or quarterly stipends or bonuses to the employees. Ours is actually a reimbursement. So the accountant or payroll person from the center submits paperwork to us and we reimburse that previous payroll. And it is a line item on their paycheck. So it's not added to their wages. It is its own line item as a wage supplement bonus or something. I don't remember what the wording is.
Yeah. And we also offset the taxes on it. So we really give about $2.08 per hour to each employee. I know Mitchell County is working on something right now currently, but it was so helpful to have those other counties. Not only were those counties willing to give us information, but they joined our meetings via Zoom. And, you know, we had really good dialogue with them. We also met with Michigan, the state of Michigan, who had a TRICARE program going on to talk to them. We're still in contact with their state. And so having partners that are willing to share their experiences and meet with us multiple times was really helpful as well.
Yeah, I know there's other counties that have programs getting started. Those are just the ones that we directly have met with to kind of see and learn from their process.
One other thing we didn't touch on was the media also picked up on this. So we did invite the media to our employer engagement breakfast. But as we were asking for pledges, Colleen with the director at our chamber, she was on the radio station. Her and Kelly Gertis, who works at CG Public Health, they were everywhere that week. And that really helped, I think. We had people donating personal checks, small amount checks to this this program, this initiative, because the media really helped us put it out there and make it known in our community that this is a shortage and it's going to start to impact our entire workforce and economy. So.
All right. I have a bunch of questions coming in, so I hope you're ready. I have one. It was related to disability. And basically, do you know if disability was addressed anywhere in your plan? Now, I will say I'm not sure if they're talking about disabled children or disabled adults taking jobs. So either or both, if you addressed either one.
You know, it's interesting that just came up at our last meeting. I don't know what we have in there, but we know it's a need for more specialized care. Alyse, I'm blanking on how to eloquently say that.
There's been requests for additional childcare options for children that have higher disabilities. So that's something that's on our radar as a need in our area. But otherwise, not that I can think of.
All right. Thank you. And now if we had a question, and right now your efforts are only working with centers. Do you see any future efforts going with in-home providers?
We completely intended to do both centers and in-home, and that was the fascinating part of us having those listening sessions, is the in-home providers really wanted other types of support. They wanted home repair, they wanted more support for toys that they go through, you know, just from constant use. So that is definitely something that we're looking for to discuss in our strategic planning. We know there's like so many different layers of what our childcare system in our area could use support on. So using that listening session with the in-home providers was really great with forming what the wage supplement program looked like. Another part with in-home providers is they were very transparent in that they couldn't even record their hours fully. Like they don't work 40 hours a week. They work early mornings, late afternoons, evenings. They pick up some time on the weekends. Like it's more of a lifestyle for them, and it's a little bit less of a structured check, you know, clock in, clock out as it was with the centers. So they didn't even quite know how they would report on their hours, just because it was so much more extensive than the workforce in the centers. So that's something we're definitely going to discuss in our strategic planning and moving forward. They also really wanted help with navigating, advocating for benefits on the in-home provider side. So that's something that we are also looking at for the future.
By benefits, we were talking like state support for like food and things like that, right?
Retirement and health insurance.
Oh, never mind. Okay, so personal
Yep.
benefits. Oh,
Personal
okay.
benefits.
There's
Yep.
something in the state law that also doesn't allow them to pool insurance for things like healthcare benefits and things like that. I also, I'm thinking as these questions come in, something I forgot to mention is we did do a survey too last summer. So in the summer of 2023, we had a survey for parents in our community to again really hone in on like, we think we know what the needs are, but what are the needs? What are your specific needs? And we, from that data and the data that we got from Child Care Resource and Referral, we really found our needs in the newborn, that 0 to 2 age. So a lot of families that couldn't find childcare for their newborns. And so we did set up this program just with our centers that take newborns versus like after school and before school programs, because we wanted to make sure that we were getting to the current need for our community. So I suspect down the road we'll continue to do data collection, and hopefully that data can confirm what else our program is missing and where we need to expand.
All right. So all right, so another question. The Alyse talked about the Child Care Ready certificate. And it was for high school students because it was offered through so it was solely for high school students, correct?
This pilot program we did just with the high school because that was we had the assistant superintendent of the school district on our team, and that was something that we started just with high school, but the intent is to be able to replicate that program even either open to the community like the general NIAC Workforce Academy certificates, or especially for school districts. It's pretty flexible with that. But the first one, the people who were enrolled were all high schoolers.
Okay. And then with that, who paid for that? Was that the grant? Did they give their time? Where did the fund?
So with this specific one, the high school is able to pay for it through Title IV.
Okay.
So we, as a program developer, developed it and programmed it as the community college, and then invoiced the high school through their Title IV funds.
All right. So that adds one more stream to your one more strand from a funding standpoint. How many total funders are we up to now? About 6, 7?
Quite a few. As far as workforce development, we have funding through the community college to do adult workforce training. So 18 and older. The below 18 was a little tricky. So learning about the Title IV funds was a neat avenue to figure out because we do have a lot of tuition assistance for out of high school.
All right. And so if this were to be rolled out to students post high school, it could still be offered free theoretically.
Yes. Yep,
Okay.
we would still do it through the Iowa GAP funds, which would be 18 and older and people looking to go into the workforce or upskilling into the workforce. We've also talked as a group to apply for grant funding to have a fund to send people through through this certificate. So a couple different avenues of funding, but we really want to make sure it's accessible.
Right. And so would you argue, and again, this is for both of you, that maybe one of the biggest challenges is consolidating these funding streams? Because it seems you have a grant over, you have a Beaumont grant, you have state workforce dollars, you have Title IV dollars, you have, again, interest from the business community, you have a 2-for-1 match with the state legislature.
So far, it hasn't. It's been more exciting to have different funding opportunities pop up. And I don't personally think it's been a huge barrier just because they kind of fit in where they need to. But maybe Jenna has different.
No, I agree. I don't think it's been difficult. I think, like, I know Alyse already talked about our flexible funding with this grant, but I think that's been the benefit of partnering outside of our sector is tapping into their funding streams and being like, oh, well, you have a grant for this. You could put money towards this through Title IV funding. Okay, you know, and so Bridget Exman, the assistant superintendent, she initially, when I first joined the collaborative, I don't think was on it. And I'm so glad her partnership, she has come in and just been so essential to us in really giving us that school side of things. Particularly, I mean, obviously NIAC was there from the very start when we thought they were going to have a child care center. But she's been able to really connect us and again, just be a important partnership in this process. So
One barrier with funding was the state 2-to-1 match was only for private funds. So that was something that we had to be a little bit creative for. And we were able to get funding from our county supervisors, from the different city councils, but we had to have private funds for the 2-to-1 match with the state. So that really pushed us outside of the normal funding sources to really tap into those community businesses and use the chamber to get the investment from the private sector.
yeah, and I think Janine on the chat said it perfectly, like actually blending and braiding that funding to go towards what you need it to, because there's also times where, I mean, again, we use the Iowa Women's Foundation to help us. They were kind of our bridge to the state because we wanted to make sure that funding wasn't put out there for something like a slot program that wasn't something we were going to be able to tap into. So that's where this truly like was a partnership and still is, and allowed us to find success in it because we could rely on those partners.
All right. You make it sound easier than at least it sounds in my mind, but okay. I had another question. It was related to what do we do for people who can't afford childcare?
That's a whole nother layer of the problem. We are excited that child care assistance does now extend to child care workers. So that does support the child care workforce. So people working in child care centers can get child care assistance, which many centers offered that as a benefit, but that meant they weren't getting paid for those kids. That was just a benefit to their workforce. So that is huge and hopefully will direct more people to working in child care. But yeah, that's childcare is a multi-layer issue, and that's another one. And that's the focus of Michigan. the model there is really focused at helping families afford. So there's a lot of work going around that area, and it's just something that we haven't directly looked at yet. But we are excited to not increase those childcare fees by being able to supplement the wages. So.
Yeah, and Kathy could probably speak to this a little bit more for our community, but we have seen a large increase of parents rejoining the workforce at childcare centers because of that state childcare subsidy. And the reason I went back to this slide is because that part of our initiative, we know that we have to continue to advocate and tell the state that we want that funding to remain. Kathy, I'll let you chime in if you have anything to say about it.
Really don't have a lot to add, Jen. It's just, you are absolutely right. From the beginning of January on, several of the programs I visited were just amazed the amount of applications they were receiving for employment. Of course, it's getting people to stay and, getting them trained to work in the programs. But we have seen, I think, what was it on the slide, like 17 workers join our workforce this January. That's really great when you're talking a program, we've got 7 or 8 centers involved right now in our program. So that's quite a few people that we've put back to work.
All right. And unfortunately, I'm seeing our numbers start to drop as we're about nearing the end of our time. One last question, and then I'll plug the next Lunch and Learn. These impact estimates, which you have the slide up, can you talk a little bit about how you got to some of these numbers, particularly on the like the 12 million, for instance?
Yes, so these were all calculations that we were fortunate enough to get to work through a financial consulting firm. Lindsay Alexander, I believe, is the consulting firm, and they were able to do these calculations. And I probably have notes from what they told us where this came from, but it was very high level. And so again, I don't have it right off the top of my head, but we really utilized their expertise. And like I said, we wouldn't have been able to work with Lindsay had it wouldn't have been for the De Beaumont Foundation putting us in connection with them and allowing us to do that with the grant dollars.
All right. And there is a note from Kelly there that if you can squint at the print, at the small print, the formulas are apparently buried in there. All right, that was our last question. Though I'll close on a comment that if Sierra Gordo's empty slot calculation was accurate, and they said there were about 3,867 slots that were necessary for all the childcare needs in the county. Extrapolating that out to statewide, it would be almost 297,000 missing childcare slots statewide. Which is to say a huge issue. And I speak personally, I actually had to leave a job to stay home with my kids because I was only making $5,000 a year after the cost of childcare, after taxes and whatnot. So thank you both very, very much. And with that, I will plug next month's Lunch and Learn is from Prevent Child Abuse Iowa and Laura Crocht. We'll be talking about teen pregnancy prevention, and May is Teen Pregnancy Month. And if we prevent teen pregnancy, we can maybe help keep some kids out of childcare. So it all ties together very nicely. So thank you all. And please enjoy the rest of your days. Eat the last couple swallows of your sandwich, and we will see you back next month. Goodbye, everyone.